My name is James DiClemente. I'm the simulation director for professional ambulance in Cambridge. We do simulation for both the ambulance side as well as the paramedic program Center for Medics. We've found a lot of great benefit to it. We've always done a lot of simulation in the clinical side working with our paramedics, but we've just recently started to implement it a lot more in our paramedic program. And we're finding that we're having a much higher success rate with our testing. We're having a much higher success rate with things like ACLS and PALS that are more course-driven, but in using simulation and implementing these simulations on somewhat of a regular basis with the paramedic program, we're noticing that they're actually performing a lot better during their testing and towards the end of their time where they may have forgotten some of those skills they learned earlier. And we've always had a tremendous effect on our employees on the ambulance side with running simulation with them and having their comfort level with low acuity skills, high acuity skills that are low occurrence like pacing, intubation. We find that our success rates with those are much higher than other services that don't tend to use simulation as much as we do, and we've had some tremendous success with those really high acuity skills that are difficult sometimes to acquire in the field. We were invited because from the EMS standpoint, we're still kind of the new people on the block for a simulation. A lot of hospitals and nursing schools have very well-established, large simulation labs that are run by full-time employees. EMS is not such the case. At Professional Ambulance, we're a little bit different in the fact that we've had a fully operational sim lab for about 5 years now, doing simulation for 7 to 8 years, which is quite unique in the EMS world. They traditionally will have a single simulator that's run by the employee of the day at that point who will run the simulations, but not someone who's necessarily a simulation specialist, not people that are trained to use the simulator. We've taken the other side of the role. We've taken more of the in-hospital side where we run it like a separate entity. We run the simulation lab like it should be run, with employees that work there on a regular basis, that are well-trained, that are well-versed in running the simulations. We have a very structured way of implementing all of our cases and the way that we review all the cases and debrief, something that's a bit unique to the EMS side. And I'll be speaking on 2 places. One will be a panel discussion on implementing simulation. So for those newer people that are just getting involved in simulation, how to set up a sim lab, how to run a sim lab effectively. And then also speaking on using using simulation specifically in EMS, and how we can best implement this to work on team dynamics and have some of those interdepartmental skills reviews that we don't always get to do in the day-to-day operations of an ambulance company. We've taken a lot of points home from it in some of the sessions that we've gone to, and more specifically speaking with different people. It's easy to get caught up in your own world of simulation, and we think that we run the sim lab the best that we can and the best that it can be run, but seeing the different ways that people utilize some of the equipment and utilize some of their specific skill sets within their departments and within their clinical environments is interesting, and we've since taken home quite a few points in discussing with some of the other people that work in our sim lab. Just from the last couple of days, I think we can make some great changes, things that we hadn't even considered because we're stuck in our own world of EMS. So just some of that communicating with other simulation specialists and people that are passionate about simulation is who we've been running into here at SUN. And I think it's really helped us quite a bit.